My patient Mr. Imtiaz Ali, 39 years old, married male, metric pass, non-smoker, without any known comorbidities, soldier by occupation, resident of Sindh, came through OPD 16 days back with chief complaints of exacerbation of pre-existing skin condition, having red raised scaly lesion in the form of papules and plaques involving multiple skin area all over the body from last 4 weeks, associated with sense of tightness. According to patient, he was in his usual state of health 4 weeks back when he was posted to a remote area, and during traveling he gradually noticed exacerbation of his previous skin condition with multiple red raised scaly lesions in the form of papule and plaque involving multiple skin area all over the body that are associated with tightness and body aches. The surface scale was brown to grey in color, thin and easily removable without any underneath bleeding areas. Patient documented that he was all right 15 years back. Then he noticed moderately itchy, scaly lesions of similar morphology and characteristics on his knees and elbows that increase in size and number and involve multiple skin area all over the body in a span of 1 to 2 years, with sparing of the axillary areas that partially improve on topical medication but never resolve completely. His skin aggravates on exposure to intense of heat, sun, sweating and stressful conditions, and improve on some oral and topical medication. He noticed premature whitening of his body hair along with hair loss from the scalp after chemotherapy, and sometime he notices subungual debris and keratosis, and also decrease in his vision. There is no history of oral or genital involvement, nor any history of fever, night sweats or lump and bumps in the body, but documented that there is significant weight loss, and he denied any history of painful ulcers over genital areas or any scaly lesions on the palm and soles. He also denied any thickening or orangish discoloration of his palm and soles, nor any lesions all over the body with islands of sparing. There is no history of any allergy to clothes, shoes, dye, detergent, plants, or any itching on photo exposed areas following sun exposure. He denied any redness of face on sun exposure or any swelling redness of the joints, but giving past history of restriction of movements at large joint of both elbows and knee at morning for approximately 20 to 30 minutes without any deformity. Over the span of these 15 years, his condition is persistent and progressive with multiple hospital admission for similar exacerbation following stressful situations. His skin biopsy has been taken multiple times with reports of psoriasis, chronic dermatitis, and finally cutaneous T-cell lymphoma. And he has been taking multiple medication since then that include infusions of high-dose methotrexate in oncology ward. He was having 6-week cycles each year for a duration of 3 years and a total dose of 900 mg over 3 years, but without any improvement of his skin condition, but results in the severe adverse reaction with blood in the urine and stool, due to which the drug was withdrawn. He also took oral methotrexate 10 mg per week for 2 months, but discontinued as having no improvement in patient was intolerant to the drug. He has also took corticosteroids, both oral and topical, and also has been on UVB phototherapy for 4 to 6 months, and now again he has been started on UVB phototherapy from last 2 weeks with some improvement. He denied any injectable medications or any other medications from government funding. There is no history of headache, fits, loss of consciousness, or shortness of breath, cough, chest pain, palpitation, loose stool, or any burning micturition. His personal, family, and occupational aspects of life has mildly been disturbed, and he denied any history of such condition in his family nor any history of tuberculosis. His past medical history is related to his current skin condition, but no any other past medical or surgical history. He belongs to a middle class family.